Hello, I'm Dr. Gordon Johnson, the Director of POCUS at Legacy Health, and welcome to the second module in our POCUS series called Basic Scanning Technique. In this module, we're going to discuss the types of transducers that you use, or otherwise referred to as probes, how to correctly position our patient, how to correctly hold the transducer, discuss the different scanning planes, and also discuss some of the terminology used in transducer movement. I also wanted to introduce you to some of the other tips for learning in addition to these modules. Again, I really suggest the book Point of Care Ultrasound by Neelam Soni as a great introduction to ultrasound for primary care, hospital medicine, critical care, and ER. Also attend courses. We're hosting some remotely, as you might have heard of now. We'll try to have them in person at Legacy, but there's also very good courses around the country that you can attend. Trying to find a local mentor is really helpful. Also ultrasound techs, echo techs. The other thing is just to scan as much as you can. Scan friends, family, patients who are willing as you're learning this technique. I always suggest to try to carry the ultrasound with you if you've got a handheld device while you're in rounds or in the clinic seeing your patients. And then comparing your POCUS results to formal echoes, CTs, and other formal ultrasounds. Just to give an example of that, here is a CT of a person who was determined to have a hepatic abscess. You can see here. So then we just wanted to see what that looked like ultrasound. So we just asked the patient if we could scan him. And here's what our ultrasound looked like. You can see the abscess there. Just to help the team, if they run into something this in the future, might alert them to what's going on. So next we're going to talk about the different types of transducers or probes that you use. First of all, the high-frequency probes. These are also referred to as the linear probe. They're really good at identifying superficial structures, such as vessels, skin, pleura, things like that. Now, the low-frequency probes come in two basic types. There's the phased array or cardiac probe that's used for what you can imagine, just mainly the heart. It's very good because it can see between ribs, and it also is good frame rate for seeing movement. So in addition to the heart, you can also use it for other structures, the abdomen and even the lung. It's probably the most versatile probe you'll have. The low frequency probe or curvilinear probe, sometimes referred to as the abdominal probe, isn't on all machines, but it's very good at going deep into the abdomen, namely. But again, it also can be used to look for fluid in the lungs. And pleural fluid is particularly good at. So when you look at the footprint of these probes, you can identify why they're called what they are and how it's helpful. There's a rectangular footprint to the linear probe, looks straight down again on vessels, superficial structures, abscesses, pleural line. The curvilinear or abdominal probe has this nice, wide, curved view that lets you see large organs like the liver, kidneys, things like that. And again, the phased array or cardiac probe to the right, you'll see this really narrow triangular footprint that's really good for shooting in between ribs to see the heart. So again, just to give you some more examples, here's a high frequency probe, and we're just watching a needle go into a vessel here in the short axis or transverse axis. So you're just seeing the needle basically in one dimension there, entering the vessel. There's also another high frequency probe that's not uncommonly used, especially in emergency medicine, often referred to as the vaginal probe, but it's actually a cavitary probe because it can be used to look in the throat as well to identify a peritonsillar abscess like here. So again, the cardiac probe or phased array, as we mentioned before, really narrow window, seeing between ribs, really good at seeing moving structures. So here's a 4-chamber view of the heart using this probe, and you can see the nice narrow triangular footprint up there at the top of the structure, the picture. Next, again, is the low frequency curvilinear abdominal probe. Again, here it's getting a picture of the liver as well as one of the kidneys there. Now, the butterfly IQ is a little different. It's a unique technology. They use a computer chip, as you can see in the lower right hand there. So it's actually 3 probes in one because it's using a computer chip instead of the crystals. So that gets a little confusing to people, but it's just the settings that you set to get the different views that we were just talking about. So again, here's a rundown of the different types of transducers or probes that you'll see. Over to the left, two examples. First the Lumify, then the Sonosite phased array probe. In the middle are the high-frequency probes, again from Lumify and Sonosite, and then the curved linear probe on the right from Sonosite, and at the top is the butterfly, kind of quote all three probes in one. Now when you are scanning, you generally have the probe marker to the patient's right or to their head, and it's good when you put the gel on the probe initially. Be really generous with the amount of gel, and you can put it on the side at first, or you can use your finger to just make sure you know which side of the screen where the probe marker is and such. An example is here. And then when you position your patient, you really want to make sure that generally you're scanning from the right side, although some echo techs scan from the left. In Point of Care Ultrasound, we generally always examine and scan from the right. And you want to make sure that you position your patient ergonomically so your head is straight looking at the screen and also can see your hand if it needs to. But note that 98% of the time you're looking at the screen as you're scanning. Now we're going to discuss the various scanning planes, the transverse, the sagittal or longitudinal, and the coronal plane. And again, remember that the probe marker being to the patient's head or to their right side in general scanning. Exception to that is cardiac, and when you're doing procedures, you always have the probe to your left. That'll make sense when you're looking at the screen. Here again is a view of the three different planes, the short axis, the long axis, and the coronal plane. So first, to start with transverse or short axis, you're going across the body here. This is typically seen in like a CT scan when you're going through the abdomen. Notice the probe marker is to the patient's right. Here we're going on the long axis or the longitudinal plane, so we've rotated the probe 90 degrees. The probe marker is pointed up towards the patient's head, and we're looking in the long axis now. And then finally, the coronal plane. This is typical when looking at the kidneys. So again, probe marker to the patient's head, and we're looking in the coronal plane of the body relative to the patient. So just to give you an example here, we're going to look at the carotid, jugular, and thyroid in short axis or transverse axis there. You can see the carotid is nice and round, the jugular is collapsible, and the thyroid is off to the right there. And then we just twisted the probe 90 degrees here to give us a longitudinal or sagittal view of the carotid here. We'll go over how to do that in just a second. And next, when you're looking at vessels to put in IV lines, there's two planes you can use. Either the transverse, which is shown above, short axis of the vessel. Here you're seeing the vessel compressed a couple times, and then below is the longitudinal or long axis that you can see. So there's various advantages of each of these views when placing a line. On the butterfly device, you can actually look at both of these views at the same time, which is a nice advantage. So next we're going to discuss on the proper way to hold the probe. So first we'll talk about holding the probe like a pen. This is classically used in most of the cardiac views. So you're using your first two fingers to hold the probe and then anchoring with your fourth and fifth digits on the patient so that you're not sliding around and losing the view. Here it's also the same technique used on the neck. This technique is used when doing ocular ultrasound as well. Next is the scoop technique, where you're gently just scooping down, looking at the retroperitoneal organs, the liver, the kidney, the spleen. Here is the fencing, lancing approach to it. We're looking at the posterior lung here, looking for a effusion. If you bring it up, you would bring your hand to more of a throwing a dart type of holding on the probe there. And then, of course, the one way not to hold the probe, which is commonly called the death grip here, is never to be done. You're typically pushing too much on the patient. You're not really dexterous with the probe. You're going to lose your views a lot. It's going to slide around. And then another uncommon way, but very important when you're doing the subxiphoid or or IVC view in the abdomen, you actually have your hand on top of the probe because you're having to push down into the abdomen and shine the probe up into the chest. So here we're going to talk about the various transducer movements. First, we're going to talk about sliding, so you can see the probe sliding to and from on the patient to their right side and left side. You can also slide the probe up towards the patient's head or down towards his abdomen. So the next motion here you're seeing is fanning or tilting. There's various ways to describe this. Some people say tilt the or fan the tail of the probe. So there we're fanning the tail of the probe to the left, again to the patient's left, and then fanning the tail to the right. They'll also talk about fanning the beam, though, in the opposite direction. So clarify that with your instructor. Next is the rocking motion. It's just as it said, you're rocking here in the longitudinal plane of the abdomen back and forth like you're moving a stick shift. And then finally, the rotating motion here, you're just moving either clockwise or counterclockwise here, as we're doing. So whenever you're imaging anything, you always want to get more than one view. Here you might see the prints as him telling us to get 3 views, but we say one view is no views, always get 2 views. The danger of that is if you just saw this view from the side, you'd think the prince was trying to tell us something other than 3 views there. So you're apt to make mistakes if you just look at one view and make a diagnosis. Now, a common problem you're going to find when you're scanning is the image is too dark on your screen. There's a few things you can look at. Most commonly, I find you're not using enough gel. You want a good connection between the transducer and the patient's skin with plenty of gel. But next, you might be going on top of a rib or another bone that's causing some shadowing. The next thing is sometimes you don't have quite enough pressure between the transducer and the patient's body. And then finally, you may have the gain set a little too low. So the next thing we're going to talk about is changing the probe from short axis to long axis. So what's really important is to keep the object that you're trying to look at right in the middle of the screen. And we'll give you 2 examples here where this object is a little off to the right. So as we turn it, we lose the object when we're trying to go onto the long axis. But on the right side here, you can see it's right in the middle of the screen there with our probe, and it's right in the middle as we turn on to the long axis. So it's important when you're turning that you're keeping that structure, typically a vessel, you're trying to keep right in the middle of the screen. Then the other thing to be aware of is called the cylindrical effect. So if I was scanning this here, I would think that this hollow structure is much more narrow than it actually is. What I need to do is fan through that to see the widest diameter to find the true diameter. This is often encountered with the IVC, as you can see to the right. And the other clue that you're on the true diameter is both the vessel walls here are very bright because they're exactly perpendicular to the sound waves, so you're getting a very good returning signal. So look for that as well, but always fan through these structures to make sure that you have the true diameter. And then finally, what I want you to try is something that our ER doc, Dr. Mike Stone, coined was the carotid challenge. So pick up a linear probe and either scan yourself, or if you have a colleague with you or a friend or family member, put the probe onto the neck and try to identify the thyroid over there to the right, the carotid, which is a nice round pulsatile structure, and then you can turn on it slowly, as you can see here, and it turns into kind of a football shape. And then here on the screen, you can see you can get it in the longitudinal axis. And just practice doing that. It's a little harder than you would think initially to get it right on that perfect longitudinal axis, but the more you'll practice, you'll pick it up really quick. And then the next thing to do is just set the Doppler settings on there for color Doppler, and you can see the pulsatile vessel. We're pointed down to the patient's heart with the beam of the probe down to the patient's heart, so blue away, red towards. The red blood is pumping up from the heart towards our probe. But if we angle the probe the other way, where we're pointing the beam up to the patient's head, you can see that the pulsatile blood becomes blue and the venous blood becomes red. So that's important to remember, that the color does not indicate whether it's a artery or a vein. It's just the direction of flow. And that's the end. Thank you and happy scanning.